Welcome to the Physical Therapy Playbook. These short modules are intended to help you get the most out of your physical therapy by better understanding what goes on in PT. I'm James, and I want to thank you for tuning in. You're taking a big step towards ownership of your recovery. Okay, let's get started. I want to start with why I made these videos, and it's three reasons, really. First, medical care is a lot. When we're injured and suffering, we often aren't sure the right path to take to get better. That can lead to less effective care and unanswered questions. Second, physical therapists are getting less and less time to spend with each patient to answer those questions. It's not fair to you, and it's frustrating to us. Because if we don't have enough time with you, we can't share all the important information that will help you get the most out of your physical therapy. So I decided it was time to do things differently and put together an organized guide to help patients with their own care. I've been a practicing physical therapist for over 25 years. No matter what problems my patients are dealing with, there are a few essential facts about physical therapy that I share with each one of them to help us get the most out of our time together. I'm going to share that information with you here in these three modules. It's basically a hack for your success in therapy. So let's get to it. Just a quick note, what follows is general medical information and is not intended to be used to treat any specific condition or diagnosis. So as you know, I've organized this series based on the three main players in your care: the doctor or other referring provider, the physical therapist, and you, the patient. In this module, we're going to focus on the most important member of the team, and that's you, the patient. Believe me, your therapist understands that when you're in pain, all you want to do is get rid of it and get better. I wish we had a magic wand to wave and make everything feel better. But if we work together, we'll have the best chance to work through your problem and find some solutions. It's going to take a team effort to have the best outcome. So with that, the goal of this recording is to help you understand what part you can play and your responsibility to give yourself the best outcome. So let's get into it. So as I mentioned, the most important member of this team is you, the patient. Your recovery goes the most smoothly the more you're involved. Every single physical therapist goes into this line of work to help people, but we can't make you better. To share a little insider tip, the patients who have the best outcomes in physical therapy are the ones who work alongside us to help them learn to help themselves. Look, physical therapy and medical management, the care your doctor gives, are different. What you and your therapist are going to do together is not like taking a pill or getting a shot. It relies on the active participation of everyone on the team in order to be effective. Now, again, I understand that this is a lot. Just being in pain is exhausting. Believe me, I know. But I also know that you're aware that to get better, you will need to get involved. You're watching these videos is a good example of that. You're going to learn some things and make positive changes and get back to the life you want to live. By starting care with a physical therapist, you've taken a step towards that goal. And like I mentioned, by sitting through this recording, I can tell you're ready to do what it takes to get better. Okay, so let's start with some simple ways you can help yourself and set yourself up for success. Okay, let's start out with something really simple but really important. All of us have experienced the joy of sitting in waiting rooms, whether it's an appointment for our primary care doctor, our dentist, or to get our taxes done. And no one has sit in the lobby all day as the top of their list of our favorite things to do. But physical therapy is a little different. We rarely get behind schedule. Our days are built around the flow of patients coming and going into our clinic, and we carefully plan out each patient's session to make the most of the time we have together. To help us to do that, you have to arrive on time. Now, We completely understand that things happen, life happens, cars don't start, kids get sick, traffic can be unpredictable. But please be on time. Do your best. When a patient arrives even 10 minutes late, the next patient is still coming at their scheduled time. In other words, we don't have the freedom to make up your time because that would mean taking time away from the next person's care, and that's not fair to them or you if you're the patient and the one before you arrives late. So being on time is an essential way to help us help you and give us more time with you. Also, communicate with your therapist to get the most out of your session time. Maybe you can arrive a little early or stay late to work on things. Some clinics have space for that, so discuss it with your therapist. All right, let's move on to talking about what you can expect during your treatment sessions and what you can be doing. So let's talk a bit about how you can expect your treatment sessions to generally flow. Every physical therapy clinic has its own character and style, but typically the sessions themselves have a similar flow. You'll start by checking in at the desk or a kiosk to let us know you've arrived, and then someone will come and bring you back to the clinic. It could be your therapist, but often it's one of the assistants or aides. First, we'll ask you how you're doing, if you're having a good day or a not so good day. That helps us adjust our session plan. How we start the treatment depends a lot on how you're feeling that day. For example, if you're having a lot of pain, we may want to start the session focused more on understanding why and trying to reduce your pain level. At the start of the session, you'll often work directly with your therapist so we can discuss your program, how you've been feeling, and what your activity has been since the last session. This is also your opportunity to ask us anything you need clarification on. Later in the session, you may work with one of our techs or aides who are trained to guide you through the program that your therapist has custom built for you. This gives your PT time to document the session and make notes of how things are going. At the end of your session, your therapist will usually speak with you briefly to summarize how things went, to be sure we've answered your questions and that you're clear on what to be working on before the next session, including your home program. So this is your opportunity to ask us any questions before you wrap up the session for the day. Next, let's move on to discussing those at-home exercises. As we touched on in the previous module, starting on day one, your therapist will provide you with a detailed home program. It should include suggestions on how to get your pain under control, as well as a few important exercises to be doing between sessions. Your recovery depends upon how you understand and work with your home exercise program, since you'll be spending much more time at home than you spend in the PT clinic. 1 to 2 hours a week at PT is not enough to address most injuries. So working on your program between sessions is essential, and it's the best way to make progress. Also, it's important to understand your program. It's your PT's responsibility to explain the purpose of each part of the program, so ask us if you're unsure as to why you are doing a certain exercise. Some of them will focus on improving mobility or stretching. Others will be aimed more at strengthening, and some may be included for simple muscle activation. If you are ever unsure of which of those areas an exercise is working, discuss it with your therapist. We want you to understand the reasons behind each exercise so you can understand how to make progress. Next, let's talk about other ways to work together to customize your program for the best results. Now that we've had a chance to discuss the program plan, let's go a little deeper into understanding how to customize it. One very important reason for in-person physical therapy sessions is understanding how you are tolerating your exercises. Every part of your care is customized to you. There is no one-size-fits-all exercises for a given problem. In order to customize your exercises, it's important to understand something, that in general, physical therapy exercises should not be painful. I hear patients every day talk about no pain, no gain, but that's for fitness exercise, not rehabilitation. Remember, some of your body parts are injured. You can't go around forcing painful movements on them. So when we give you an exercise, we'll want to modify it to be best tolerated. So here's some simple rules to follow to do that. If the movement is painful, back off. If you can do half the movement without pain, then do half the movement. If you can do 7 repetitions but you have pain on the 8th, then stop at 7. Your program relies on setting a tolerable baseline and then progressing from there, not forcing movement. These soreness rules are a similar concept. Basically, that if doing something makes you sore, you should back off. If you're sore immediately after, you probably did too much. Soreness the next day, that may be okay. This, again, is something we can't figure out without your feedback, and your therapist will be asking you about it all the time. Now you understand why. It helps us to customize your program. All right, let's talk a little bit more on activity between your therapy sessions. So what you do, but oftentimes don't do, between your physical therapy appointments is just as important as the program itself. I'm talking here about learning to adjust your daily activities, something we call activity modification, to set yourself up for success. This is a conversation that you'll need to have and continue to have with your therapist throughout your care because the details are different for each person. Your therapist understands that it isn't easy to ask people to stop the things that they need to do or enjoy doing. In fact, physical therapy is supposed to get you back to the things you love, and we get that. But at the start of your care, it will be very important to identify and, if possible, eliminate the things that could be making your condition worse. No one can make these changes but you. That's why you're the most important person in the care. It's something that you will have to do for yourself. We will explain the specific reasons why an activity could be harming you, but let me just say that it is very difficult to get a patient better if that patient is off between sessions doing things that are harming them. It could very well be the difference in your recovery. Generally, as you improve, we will guide you through the process of adding activities back into your life, which is why it's so important to have frequent conversations about activity modification. It's okay if you feel like the kid in the back seat with these conversations on a family road trip who keeps asking, like, are we there yet? But I promise we're going to be patient and help you keep you focused throughout the journey. Okay, we are almost there. Just 2 more slides to go. All right. So after all this talk about what you'll be doing, not doing, and feeling during PT, let's get back to the big picture, that you've come to physical therapy to fix your problem. To evaluate if your PT program is getting you better, we'll need to measure progress. In the therapist module, we talked about doing progress evaluations, and a big part of that is understanding how you're functioning. Success is not only defined by reducing pain, although that's a big part of it. Your therapist will regularly ask you how things are going in your daily life, what's getting easier, and what is still difficult for you. We'll also be taking measurements to see what's improving, your emotion, your strength, your balance, or something else. Remember, just because some things are still hard or painful doesn't mean you haven't improved in other areas. So be ready to have that conversation with your therapist and be ready to share with us what's going well and what's not going so well. We need that information. Also, every program needs to be modified at times. Sometimes that's because you've made progress. Other times it's because you've had a setback. Don't let that discourage you. We're all people and we're not perfect. Participating in that conversation with your therapist is the best way to learn what's working and for you to learn how to adjust your behavior and get back on track. At the end of therapy, the best possible outcome is that you not only feel better, but that you've learned some ways to take better care of yourself, be more active, and overall lead a healthier life. Okay, one last thing to discuss, and that's scheduling your PT sessions. Every plan of care in physical therapy is different, but generally you'll be coming in for a number of visits over a period of a few weeks or sometimes more. The details of that conversation should start on the first day of therapy, but if you're ever unsure of how often or for how long you'll be coming in, be sure to ask. Typically, how often you'll come in changes as your care goes along, with patients usually attending therapy less often as they improve. So, scheduling your appointments and knowing how many sessions you've booked is something you'll need to keep track of. One of the more challenging moments in therapy, one of my favorite moments, is when a patient says to me, usually at the end of a session, "Hey, I think this is my last PT appointment." Most clinics are built to be busy, and sometimes that patient will have a difficult time finding an appointment for the next week if he or she didn't book ahead. Not booking ahead risks missing a week of PT if you can't find an appointment. That's because we have a finite number of appointment slots, and most therapists, and patients for that matter, don't like being double booked, so we generally avoid it. Last, when you book your sessions, try your best to stay with one provider. The best way to make progress is to keep working with the therapist who knows your case and has worked with you all along. While it's okay to see a different therapist occasionally, try your best to avoid bouncing around to different people. It gets confusing for you and for us. So track your appointments, book in advance, and ask us about upcoming sessions regularly. So, in review, your part in the recovery process is probably the most important one. It's important to keep track of your schedule, communicate with your therapist about making more appointments, and arrive on time for each session. Be sure to take ownership of your home exercise program and communicate with your therapist if you have questions about or input on the home program. Soreness rules and activity modifications are essential tools for your recovery, so try your best to understand them and ask your therapist if you have any questions about either one. Great job taking the time to better understand how to get the most out of your recovery and give yourself the best chances for success. If you haven't watched the other modules in this series, I'd recommend you check them out. There's a lot of information in there that you'll find helpful in understanding the rehabilitation process, the team, and your care. Also, check out my YouTube channel for other informative physical therapy videos as they're added.